I'm so excited to have medical facilities here in town. It's been decades, I think, since we've had anything like this.
Transportation's a real issue in getting access to healthcare. We've got patients that either use the emergency room as their primary care doctor, or they don't want to go to the emergency room because they don't have a way to get back home. It's too far.
We also then realized there was 33 plus counties in the state of Texas that didn't have any access to care, whether it be primary care or mental health services.
Many of these rural communities have lost healthcare providers over the years, and the days of trying to recruit a physician or recruit a nurse to your community to hang a shingle and start a practice are becoming harder and harder.
They weren't getting access to health care like everybody else. They didn't have insurance. Their blood pressures were high. They didn't have medicine for that, didn't have a doctor to go to.
A lot of my family lives in rural communities where there is no health care. Where my grandparents live, the hospital just closed this past year. So getting to go into these rural communities in Texas and getting to bring back health care is really meaningful to my family.
We recognized a need in our community. We're in an underserved area in Burton, and if you're from this area, you know that community comes together.
So we partnered with them again through our rural medicine program and did the first one a few years ago, and then have now realized there's even more partnerships between all of us that we can make this happen.
Why are we doing this apart? I mean, with technology and digital health, you can really leverage healthcare providers all across the state. And so sitting down together, we said, guns up, gig 'em, together we are better.
One of my biggest joys of these projects is the teamwork. It's really assembling the folks that can make today happen like it's happened, right? Collaboration, it's the key, really.
This clinic is Washington County, is Burton's clinic, and partners like Spyglass that give in that spirit, I think are what's going to change us and the impact we can have to scale a model like this across the state.
It just takes a huge headache away because the who y'all are, what you do, and the quality of work.
It's been wonderful to see how so many different organizations have come together. We had a dream and an idea to bring healthcare closer to our neighbors.
It took many parts to bring this all together.
We felt like absolutely this is a great opportunity for us to provide that support and give back to our communities.
To be able to have quality health care right here in town without having to drive 60 miles or more for that is phenomenal. I'm excited for our residents.